Hi, I'm Sharon Moore from Wellspoken. This little video is about what is the upper airway. And I guess you might be wondering what it is because it's not something that we really talk about in everyday life. So let's dig in a little bit. Well, essential life functions happen in the upper airway: breathing, eating, drinking, communication. They all happen there every day and every night. We don't think about them until something goes wrong. They just happen, right? So you may be wondering even, what is the upper airway? What does it mean? And in a nutshell, the upper airway begins at the front of the face and extends just beyond the larynx or the voice box. Mostly people are unaware until something goes wrong. And when things do go wrong, there's a medical name for it, and you might hear words from your medical specialist or your dental specialist like dysphagia or swallowing disorder or sleep disordered breathing or dysfunctional breathing or chronic cough or snoring or mouth breathing or obstructive sleep apnea. You might even hear a word like dysphonia, which means your voice is not working properly, or a speech disorder or a myofunctional disorder, just to name a few. Now, who needs help with a disorder of the upper airway? Your medical or dental specialist may have referred you because they've already formed an opinion that you would benefit from an upper airway assessment and treatment program. Best results occur with a team effort, and early detection and treatment is ideal, but therapy can occur at any age. So, common reasons for referral: no matter how much I sleep, I still wake tired. My patient can't tolerate CPAP. After tonsillectomy, my child is still snoring. My daughter Ellie wants her braces off for the school formal, but the orthodontist said not until the tongue thrust is fixed. I have to clear my throat and cough all day. It barely stops, and there's irritation in my throat all the time. My throat tightens a lot when I'm near strong smells like perfume or paint. Sometimes it's so tight I can't swallow or speak. My son is a restless sleeper every morning. It looks like a hurricane went through his bed overnight, and then he acts like a hurricane all day. It's exhausting. Allergies seem to run in the family, and so do snotty noses. We're all mouth breathers. My son's breathing at night sounds like a freight train, but he's not snoring. Does that mean he's a deep sleeper? No, it doesn't. My son is 4 and still has a dummy at night, and it's wrecking his teeth. Johnny had his tonsils and adenoids out. He was okay for a while, but his snoring has started again, and it sounds like he might stop breathing sometimes. My son yells all day and often loses his voice, and the ENT says he has nodules. Is that bad? I noticed after the tonsils were taken out, my daughter has really nasal speech. Katie still chews with her mouth open, no matter how much we remind her. Michael's 3, he has low muscle tone and he drools a lot. Samuel's a mouth breather and his mouth is always open. I can understand my daughter, but her tongue is always sticking out while she's talking. Now, of course, there are many more reasons that you may be referred to Wellspoken, but rest assured, if your specialist sent you, there will be a good reason. Thank you so much for tuning in, and have fun exploring the website and resources. But don't forget, if your kids have breathing issues day or night, grab a copy of Sleep Wreck Kids and stay tuned for 3 new publications coming called Well Slept Kids, transforming your kids' sleep before they start school. Thank you so much for tuning in. Have an amazing day and have fun exploring the website. Thank you so much.